Hello, my name is Dr. S. Rawat. I'm a physician trained in England and based in Canada. I've written over 40 blogs, and this blog is about the management of fatty liver, also described as non alcoholic fatty liver. Here, I did talk about some correlation between the incidence of fatty liver with more severe COVID 19. But getting down to diagnosis, fatty liver is an umbrella diagnosis which includes a simple initial grade 1 fatty liver, and even going up to steatohepatitis, cirrhosis, and liver failure. There is a very strong correlation between obesity, insulin resistance, type 2 diabetes, high cholesterol, including high LDL as well as low HDL, so high bad cholesterol as well as a low amount of good cholesterol, with non-alcoholic fatty liver disease. So it's considered to be part of an overall umbrella of metabolic syndrome. Generally speaking, the kind of lifestyle changes you make for those conditions helps with this as well, and I have done several blogs on those topics separately. So most patients are asymptomatic, although when questioned, some patients do report certain symptoms such as fatigue, malaise, or upper abdominal discomfort. And a significant amount of the population can have fatty liver purely based upon imaging itself. And so generally I take it in context of overall metabolic health, blood results, etc. So by definition, if you have more than 5% fat content in your liver, that is the start of a simple fatty liver. And this can progress if you're not careful with adjusting your lifestyle accordingly. Here we have some epidemiological and population surveys from the US with regards to how common it is, and I'd encourage you to go on my blog and read this in more detail. Also talks about the expected incidence and progression to cirrhosis, fibrosis, and in fact it is now the most common cause of liver transplant in women and the second most common cause of liver transplant in men after alcoholic liver disease. It's also becoming a more common cause of liver cancer and cirrhosis. However, one reason perhaps why fatty liver is not taken seriously by certain clinicians, which I feel is unfortunate, is because generally speaking, the most common cause of death in patients with fatty liver is not liver failure, but other cardiovascular diseases such as strokes, heart attacks. And this being because, as we mentioned before, this is part of an overall umbrella diagnosis, which also often includes other conditions, including high cholesterol, raised sugar, raised blood pressure. So it's important to look at all these conditions as a combine. There is some evidence that patients who have chronic inflammation can have increased amount of autoantibodies, and it's very important to be mindful of that. Here we talk about serum leptin levels and other kinds of pro-inflammatory markers which can be increased when you have obesity and how that plays in to the diagnosis of fatty liver. Here we talk about management strategies, diet and exercise, how you can have a calorie restricted diet. Also, the quality of diet is important, so reducing saturated fats, but more importantly, reducing processed refined sugars, sweetened drinks. High fructose corn syrup is likely the biggest culprit when it comes to progression of fatty liver. Increasing exercise, reducing alcohol intake. As we mentioned before, high fructose diets have a very major part to play, and here we talk about mouse model studies and other studies which have shown that connection. Regular exercise is important, and there have been trials in which the amount of fat accumulation was reduced in patients who had regular exercise. Also in the blog, I talk about certain types of supplements which can be considered, as well as certain medications which have been tried, including cholesterol reducing medication, certain vitamins, omega-3, certain medication we use for diabetes, to reduce cholesterol, and some more supplements are mentioned here. So I would recommend that you go on my blog and check that out.